name is Sofia, and today we'll be teaching how to conduct some exercises for patients that have been late for a while in a post-operative case. So, why this is so important? After doing surgery, patients will be laid in the same positions for a very long period of time, and that's very dangerous. First of all, if the patient is late for too long, might be a case of pneumonia, and which can develop into other diseases, and might also weaken the immune system, which will make the patient more open to nosocomial infections. And also another part which is very important is for ulcer pressures, and not only ulcer pressure, but in the case of the legs, which I'll be focusing on today, is for avoiding blood clot, or most commonly called thrombosis. Why this is so important? Because thrombosis happen when the patient is laid. There's really bad circulation towards the leg. So the first thing is that usually you should hide the patient's leg with maybe a pillow or something during the rest, and you should realize exercise every day for this not to happen. So first step, you should ask the patient how he is, how is the surgery, introduce yourself and explain the procedure. So good morning, Donovan. My name is Sofia. Today I will be your nursing assistant. How was your surgery?
Yes.
Okay, are you feeling good? That's awesome. I will be conducting with you today some leg exercise, okay?
Okay.
That's good. So each exercise that I'll be showing today should be repeated 10 times at least, but for the purpose of the video not to be too long, she will be demonstrated just twice. So the first exercise will focus on the feet. So I will ask her to do ballerina point, and use her strength. This is for make the muscle work, and go back. Go on and go back. This should be repeated 10 times, but like I said before. Okay, after that, the next exercise will be lifting up your leg. So lift up your leg as high as you can, and then down. As high as you can, and then down. This step is important because this is one of the exercises that you should be really assist the patient, because depending on the surgery that he had before, that type of exercise is impossible to be done. So this is just a general set of exercises, but it depends individual of the case of the patient. So the patient might have difficulty in performing some exercise, and you should assist him in those situations. So everything's okay?
Okay.
Okay, so she said it's fine. We can proceed with the exercise. So lift it up. And lift it up again. Okay, so the next one is she will bring her leg close to her knee and hold it and stretch again. Hold it and stretch again. It should be repeated on the second side. This may be a little hard for some patients and that cannot be performed in case of belly surgeries, of course, and it might be cause some aching on the knees. So the next exercise is for strengthening the knees. So I will ask her to push down her knee, like pressing her knee on the table and then relaxing. Pressing her knee on the table and relaxing. That will arc her thighs. So it's very important for her. If it's hurting, you will need to find another exercise, but it's hurting?
No.
So she said it's not hurting, so we can proceed. So, pressione. You should not put any pressure. The pressure should be her pressure on the table. So, those are basic exercises that you can do with the patient, and of course, encourage the patient to sit up. And stay seated for a while so she can breathe and make her pulmonary system work better. So breathe in, respire, breathe out. This should also be done for not to make any problem in the lungs. And after that, after the whole set of the exercise, if the patient is tired, you may lay the patient again and ask if everything is fine. Everything's fine? Okay, so she said that everything's fine, and that should be done a few times a day depending on the condition of the patient.